Health Education Lecture Series. All the listeners of Health Education Lecture Series, welcome to my show, Health Education Lecture Series. And I'm your host, Gurdeep Singh Sandhu, homeopathic consultant. I'm here at 9701 Sarah N. Court, Dublin, California, 94568. My phone number is 408 687 1899. Email address homeomedicine, HOMEOMEDICINE at yahoo.com. So, welcome, Radio Pravas. They are also joining with us, and today is the time for the English lecture. And we are doing the survey, a review of all the previous lectures since we have started the how the life was created from life, and we are giving just synopsis of all the lectures in short in one lecture. And after that we are going to start a new chapter, a description of formation of this body and all the organs systematically we will discuss later on from head to heel. And in this one we will structurally define everything, how a different system has been created, how a different part of the body has been created, how many systems are there, and how they are formed, what are the organs in those systems, and what they do. So all these descriptions I will give you later on, but today is the lecture, English lecture for our review what we have done in these lectures in our previous lectures. So, since life was created, I have given you the description of how the ovum was formed. First of all, before starting with the ovum, I have described you about the menstruations. And what's the menstruation? How they are formed? What are the hormones taking place in the formation of menstruations? What are the problems of menstruations? And how the ovulation occurred 14 days before of the next onset of menstruations, how it travels from ovary to the fallopian tubes, and ultimately it meets with the spermatozoas if they are there. Previously, before the marriage life, there is no spermatozoa, and ultimately this ovum passes over from the ovary to the fallopian tubes and passes into the uterus, and from the uterus onward, with the menstrual flow of blood, it goes out. This was the normal routine before the married life. And when there is a normal married life and there is a chances of pregnancy, ultimate there was a different view and a different routine followed by this ovum. And when it enters into the fallopian tubes, it meets with the spermatozoas. I told you about that how these ovums are formed inside the uterus. There are two layers of the ovaries. I describe you about that one, the cortex and the medulla. From the medulla, from the inner layer, there is a formation of oocytes. Oocytes, and then one of the oocytes develops in the ovulation ovum. And ultimately, that ovulation is enlarged, that big one, that it touches the walls of the ovary, and ultimately that wall is ruptured. And this is all happening under effect of the hormones, follicular stimulating hormone, estrogen hormone, and LH, luteinizing hormones. All these hormones were playing part in that one for the formation of the ovum, and ultimately the liberation of ovum from the ovary, and that ovum travels in between the layers of the broad ligament, which covers the whole genital organs of the females in the abdomen. That's known as the broad ligament. And within that broad ligament layer, this ovum travels into the fallopian tubes and enters into the fimbriated end of the uterus. And when it reaches into the second portion, that is the ampullary portion of the fallopian tubes, ultimately it met with the spermatozoa, if it happens, if the sperms are there, or still it has sometimes so that it can meet with the spermatozoas. And on the other hand, we have described you about that the spermatozoas, how they are formed in the testis, how they are discharges from these testis, and ultimately it passes on to the prostate, and ultimately through the urethra it goes outside and ultimately deposited into the vaginal areas. The millions and millions of the sperms are discharged at one ejaculations, and though only one sperm is sufficient to pregnant or to fertilize one ovum. I don't know why the nature has produced that much quantity, a big quantity of 120 to 150 millions of sperms at one ejaculations. And they are regularly formed. And they are regularly formed in the testis. And that story I have already told you about, that one where they are formed, how they are discharged out, they come out of that one, and it goes to the head of the epididymis, and epididymis to vas deferens, and vas deferens to prostate, and prostate to urethra. So that story I have given you in details. And after that, when they reaches into the vaginal area, all these sperms are formed in an alkaline media. They survive in alkaline medias, and they are protected even in the prostate. They are provided with the alkaline medias. But when they enter into the vaginal area of the female, that has an acidic reactions. That has an acid medias, and ultimately most of the spermatozoas were killed over there because they are large in numbers, and ultimately few of them, it is estimated, they survive from the acid media. They survive from the Dodderlines bacillus, which are the regular resident of the female vagina. To keep it clean, there should not be any infection. To keep it clean, there are permanent resident of the vagina. Those are known as Dodderlines bacillus. And ultimately the WBCs, because these outcome from the sperms coming from the outside, they are considered as the uh, foreign bodies, and our body is maintained in this way and is in functioning in this way that whenever anything outsider comes inside our body, they are fighting with our WBC, or our WBC fights with that to kill them. Ultimately the Dodderlines bacillus and the WBCs plus the acid media, they all are killing those sperms. But even then, from millions, few of them, it is estimated that near about 200 sperms survives and reaches into the uterus. They travels up into the uterus and reaches to the fallopian tubes. But here I told you one story, that because there are two fallopian tubes and there are two ovaries, and ovaries are producing ovum alternatively. Not every ovary is producing every month an ovum. No, only one ovary is producing ovum, the other remains silent, sleeping. And the next month, the previous one sleeps down, and the next one produces the ovum. In the same way, when 200, for example, if 200 sperms are entering into the uterus and they are divided into two portions, goes to the two fallopian tubes inside the fallopian tubes, and means they are divided. On one side, they are not getting in the spermatozoas, and what is the fate of those? That goes under autolysis, a natural process of converting into liquefaction. They are liquefied, and from when they are converted into liquefations, they are sucked by the normal circulation, that's by the veins over there. So blood, it goes to the blood again, into entering into the circulations, whereas the on the other side, where there is a ovum, ultimately they surrounds the ovum. It was a difficult situation at that time. It's not easy for the sperms to enter into the ovum because it has an outer shell. You might have seen the eggs. The outer shell is very hard, and that is known as corona radiata. And that's the outer shell is very hard, and it is difficult for the sperms to enter into the ovum. Though sperms are surrounding the whole ovum from circumference, but ultimately they died. One, from by hunger, because they were not having the sufficient food till they are released from the testis and enter into the vagina and the uterus and ultimately in the fallopian tubes. So they were exhausted at that time. Plus, they were not having that sufficient food at that time. So ultimately, they were trying to enter into the ovum, but they could not. Ultimately, they are dissolved. They are dissolved by a natural process known as autolysis. And when they are autolyzed, this whole liquefaction turns the liquefied the outer layer as well. The outer layer of the ovum also becomes weak. And then the late coming sperm, if they are some, the late coming sperms reaches to the ovum, and it is very easy for him to enter into the, because that layer has been converted into soft. So layer, outer layer of the ovum, because of the autolysis of the sperms, has become soft. And now the late coming sperm, if, because I have told you that we need 80% active and motile sperms, with having head, neck, tail, body. All these things should be perfect in 80% of the sperms. And the normal quantity, I have already told you about that one. But if they are not 80%, ultimately the fast going sperms will go over there and die in the first instance. And ultimately there will no chance of the pregnancy. But if 80% sperms are active and motile, and out of this 100, for example, out of this 100, some of them has already died, and the late coming sperms enters into the ovum. And when it enters into the ovum, fertilization starts. A new life begins. And ultimately, there was a story how they fight, how they enter into it, how the chromosomes of the ovum and how the chromosomes of the sperm head fights with each other, and ultimately they adjust with each other and starts a new life. And ultimately, this fertilized ovum travels towards the uterus, because the height of the uterus is downward, and the head of the fimbriated end of the fallopian tube is a little higher. So it travels and slips down, and ultimately it reaches into the uterus. And if it takes a long time, because I told you about the length of the fallopian tubes here, the length of the fallopian tubes is from 10 to 12 centimeter. And if it is a longer length, it may take long time for fertilized ovum to reach into the uterus, and then the body of this fertilized ovum will become larger, and the hole or the door, you can say, from uterus to fallopian tube is measuring only 1 millimeter. Just you can well imagine. It's only 1 millimeter. And if this fertilized ovum is enlarged enough, which do not fit into this door, will not reach into the uterus. And ultimately, it will continue its life in the fallopian tubes, and that's known as tubal gestation. And that has no fate. Ultimately, that is killed in the fallopian tubes. And in a previous life, many ladies were dying because of this fallopian tube or tubal gestations, because there was no such sufficient food for this new fertilized ovum to develop, and also there is no space as well. So that's why the fate of this fertilized ovum in the fallopian tubes was not more than 3 months. But ultimately, we are going with the normal life, and it reaches into the fallopian tubes, into the uterus, and then it is inserted over there. That story I have already told you about that one. It is, and it develops in the surroundings of the fertilized ovum. It develops a finger-like projections, just like pins. And ultimately, those pins, by these pins, this fertilized ovum is easily inserted into the inner layer of the uterus, that is the endometrium. And then it starts sucking blood from that endometrium, which was already every month it was discharges with the menstrual flow. But now This is being sucked by the fertilized ovum over there, and then the pregnancy starts, and the fetus's embryo starts developing over there. So after that, the story I told you about that one, the inner layer of the uterus, that is endometrium, now it has a different name that is known as decidua. So I told you about that decidua. It has three parts, three different names, that the different parts. Where this fertilized ovum means the embryo has been inserted into the uterus. That portion is known as decidua basalis. And the other surrounding decidua, it covers that fertilized ovum so that it should not fall down. It will covers it, not to fall down. It's a natural process, and ultimately it start well within the capsule of the decidua, that is known as decidua capsularis. And the remaining portion in the uterus, the other portion of the decidua, is known as decidua vera. So I have given you the details of these deciduas and their functions in this area. And also there are some abnormalities, that this fertilized ovum, that's the embryo at this time, is not inserted in the upper portion of the uterus, sometimes because of the excessive uterine movements. That movements I told you about, that one, are known as uterine shuffle. Uterine shuffle movements starts with the increasement of hormone hormonal activity in a female when it starts becoming young, adolescence age. At the adolescence age, the hormones start increasing in quantity, and ultimately that increases a type of movement that is known as uterine shuffle, that we do not feel it. But when there is a menstruation, when there is a some type of problems, we feel these movements, just like heart is palpitating. We know that, but we do not feel it. And it's palpating 72 to 80 per minute, but we do not feel it. The heart is palpating if we are normal, but if it's abnormal, something wrong is over there, then we feel it. The same way, the uterine shuffles, we do not feel these movements until and unless there is any problem inside the uterus. That may be menorrhagia, that may be metrorrhagia, and different kinds of menstrual problems and different kind of pregnancy problems. These movements are excited more per minute, and ultimately the lady feels pain with that one. So that may occur. And the second thing I told you about the decidua, that sometimes this embryo is not inserted on the upper portion of the uterus, because uterus fallopian tubes are attached at the body and the fundus, where the body and fundus of the uterus joins at the upper one third, you could say, at the upper one third of the uterus, and the lower two third portion is still remaining. So, in case if there are excessive uterine shuffle movements, sometimes it may fall, or because of some jerk, sudden jerk, it may fall down and is inserted in the lower segment of the uterus, and that also causes a problem later on at the time of delivery, that is known as placenta previa. Because normally, when there is a delivery, head of the fetus comes out, or even any part of the uterus. Sometimes there's a breech presentation, not the head, the other portion, the hip portion, or the any other portion may come out of that one. There are different stages, and there are different position of the fetus when it comes out during delivery. But in case of placenta previa, because it is just at the mouth of the uterus, placenta previa comes down first. And when it comes down first, and it is detached first, detached before the fetus comes out, then there is a heavy bleeding. And it may cause stillbirth as well. Because for 16 to 17 hours, child is not provided with sufficient food and oxygen. And if it's not provided with food and oxygen at that time, child may die. These type of conditions, these types of complications may occur with the placenta previa position. But nowadays, our technology has advanced, and we easily know beforehand during pregnancy, because there are antenatal clinics. There are antenatal clinics when a lady becomes pregnant. At the same time, we start going to the hospitals and the doctors check us regularly. And at that time, when the ultrasounds are done, then we know that yes, the position of the fetus is normal or not, that the insertion of the placenta is normal or not. So under those conditions, if it is placenta previa, and that the placenta previa will also have different conditions, partial placenta previa or complete placenta in complete placenta previa, it is not possible, even doctors do not take risk that let the placenta come out and then the fetus will come out. No, till that he may die. Or that's why it is advised nowadays, and also we are having those measures that we can go for surgery, cesarean sections, and both mother and child may be survived. In this condition, this is what going on normally nowadays. But previously it was happening that if there is a placenta previous, most of the children were dying, and sometimes because of the delayed labor, even the ladies were dying because of that one, because there is a heavy bleeding after that. When the placenta previa is detached, there is a heavy bleeding, plus the fetus is still inside, plus he is not getting sufficient food and oxygen. So there is danger for both of things. So this is what I describe you in detail. Ultimately, during this periods, I have told you about the development of the fetus, how the fetus is developed, how we can judge the abnormalities of the fetus in the mother's abdomen, and ultimately how we are now able to correct those abnormalities in the mother's womb by, if the problems are acquired problems because of our fault, diet, exercise, jerking, accident, anything. If it hits the fetus, sometimes there may be a rupture of the insertion of the placenta, and there may be bleeding for that one. Even the bleeding sometimes may occur. There is a laceration of the alveoli, chorionic villi, and then there is a heavy bleeding, and sometimes this child do not develop in a normal fashion. And if it's not developing in a normal features, normal structures, then also sometimes at the 20th week, doctor advises that your child is not developing normally, you should go for abortions. And if, or miscarriages. And if you will continue with the pregnancy, he may suffer from many diseases in his life, and also it will be a problem for you to maintain this life. So sometimes, if we detect these kind of conditions, we advise the lady to go for miscarriages, or that's known as medical termination of pregnancy, MTP. Medical termination of pregnancy is usually used term in the hospitals when the doctor detect that the child is not developing in a normal way. So, and there are some problems, there are some abnormalities in the structure formation of the body of the fetus, then they advise that yes, you should go for the MTP, medical termination of a pregnancy. So this is what, there are many more other conditions we have already discussed, because it was a long lectures. Many lectures I have given on those one, because what are the problems at this phase and how we can solve those problems. But still, I told you about that one. If the problems are genetically, these problems are acquired from the parents, then sometimes we are not able to correct those problems within that limited periods. And sometimes because of those problems, doctors are advising that yes, you should go for MTP. But if sometimes the parents are not agree for the MTP, then ultimately the child is born under same deficiency conditions, and there are deficiency in the developments, there are deficiency, and even the chances that he may be handicapped by some or the other way. So in this way, we should follow the instructions of the doctors at that time if there be any condition ultimately. And I have told you about the delivery, uh, and this delivery, how it happens, what is the mechanism of delivery, why it starts. Because child was living normally, mother was providing prepared food to him, and he was developing, he was jumping, this and that, everything was going on normal. Why this pregnancy start, delivery starts, why the labor pain starts. So I have given you the detail of a mechanism of this thing, that this labor pain starts because of the hormonal activity. So ultimately there are three stages of the labor: the first stage, second stage, third stage. And I told you about the story of these all stages, from what stage to what stage. This is first stage, that is 12 to 16 hours, sometimes 12 hours normally. And after that, the second stage, that's only takes about 2 hours, not more than that one. And after that, the third stage, it may take half an hour even. Sometimes it may be late, delayed placenta, or sometimes because of the some other complications with the fetus as well. So all these things we have described you step by step, and with the time periods, with the sign and symptoms, that you can judge that this is the first stage, this is the second stage, this is the third stage. In this way you can manage that. And I have told you about the managements, how you can manage the labor. This is what we have discussed in these lectures. So ultimately, after that, we have a period of golden hours when we cut the umbilical cord, and there are special instructions how to cut the umbilical cord, and how to check the placenta, whether the whole complete placenta has been delivered or not. Then check the fetus, whether it is normal in constitution, normal in structural formation, or there be any problem. So all these things we can judge. These things are known as anomalies. Deficiency in the structural formation of the body of a newborn is known as anomaly. Most of the anomalies are detected within 2 hours after the birth. Some of them immediately. Just if there is a cleft plate and a cleft lip, the rupture of the lip, sometimes you might have seen that. And some of the problems we can detect within 2 hours. So to suppose if there is a phimosis, means the urethral opening is not completely opened, the upper covering, that is known as prepuce, that is not separated and that is joined. In that condition, a child cannot urinate, because previously in the mother's womb everything was taken care of: stool, urine, everything, feeding, everything was taken over by the mothers. But now he has to pass urine by his kidneys, by his bladder or urethras. And if the urethral opening is not completely opened, ultimately this is known as phimosis. And sometimes immediately after birth we need to go under surgery to dilate that one, or to circumcision, sunnat, circumcision, we have to do that. So all these measurement and all these things I have described you in detail. After that, I told you about the to check and examine within 2 hours. Sometimes there is a child is not passing stool, and there is not normal formation of the intestines. I told you many of the organs inside the body are formed part by part. Just like I can give you example: the large intestine, it has its different portions: ascending colon, transverse colon, descending colon, and in between the joints, the flexors: right or hepatic flexor, left or splenic flexor, downward sigmoid colons, and there are different joints. So all these organs are formed separately, and ultimately they join with each other. And suppose if it's late in formation, then sometimes any portion may not be joining completely till the birth of the child. So then what will happen? This train is not linked with each other, and the stool which has to pass meconium, the first stool of the child is known as meconium. If a child do not passes the stool within 2 hours meconium, then ultimately we can assume there is some problem in the intestines, and then we have to check. And sometimes it immediately may need surgery because of the deficiencies. But normally, if the child is developing normally in the mother's womb, a child passes meconium within 2 hours of the birth. And after that, I had told you about the problems of the newborn. What are the problems of the new? Because previously, when we were not, our science was not fully developed, and we were not knowing what are the causes of the children's death. Even within 1 year, many of the children were dying. Some of the conditions which I told you, like phimosis, like deficient formation of the intestines and all that, sometimes it may cause problems when the surgery was not that advanced and children were dying immediately after birth. And after that, within 1 year, there are many more other diseases with which children were dying within 1 year of their lives. And I told you about those diseases. These some of the diseases are viral diseases, some of the diseases are bacterial diseases, some of the diseases are some structural formation diseases. Ultimately, for those structural formation diseases, I have told you about the uh, just you can say the hole in heart, eh? Foramen oval. Okay, our foramen oval is a normal structure formation in the heart, but that closes when a child is born. Ultimately, it starts closing, and it has a limited time of about 6 months to close that one. But if it's not closed within 6 months, then a mixture blood goes to the circulation of the child, and childs are weak, child are cyanosed, because they are not supplied sufficient oxygen by that, because the whole blood is not going to the lungs, and whole blood is not taking up the sufficient oxygen which is required by the cells, and the blood is passing directly, deoxygenated blood is directly passing to the right from the left side of the heart, and again it goes to the circulations. But if that foramen oval is closed from right atrium to left atrium, this is a normal phenomenon, because when the child was in mother's womb, at that time, lungs were not working, and there was no use to send the blood to the lungs, because everything mother was doing. But now that connection has been disconnected. It has come out of mothers, and now the lungs are flattened immediately when it comes out, because of the environmental pressure. 480 of Hg, everybody knows about that one, that our environmental pressure, 480 of mercury pressure is in our environment. And when this child faces, when it comes out of mother's womb, it faces that pressures, and with that pressure the air goes in and child cry. With that one, there are many things happens inside the heart, that the tricuspid valve is open, that the bicuspid valve is open, that the semilunar valve, which is supplying blood to the heart, is open. So there are various changes occurs inside the heart, but if they are not occurring, sometimes it may create problems. Or if some of the openings, just like the foramen oval, they are to close after the birth, and the blood should go directly to the lungs. In spite of going directly to the left side, it goes to the lungs, and from lungs it goes to the left side, and then it takes full oxygen, and it supplies full oxygen to all the tissues of the body. So this is what I have given you detail. I think everything has taken 1 or 2 lectures to explain you about this one, how it happens inside the body, and how the nature maintains this thing, and how long it takes to maintain all these things. So all these things I have told you about that one. So in the newborn life, that is considered up to 1 year. A child, when born up to 1 year, it is considered as newborn. And within that newborn child, I have told you to identify the anomalies inside the body, means what are the deficiencies in the formation of this body, and how we can maintain all these things. Second, the diseases which are what are the diseases at that time a child may suffer, and the previously the children were dying because of those viral diseases, because we were not having any clue about that one. But now, after the development of this vaccination therapy, we are competent to treat those diseases, and now the children are surviving, and the death rate has declined to near about 3 or 4%, where it was 50%, even more than that. The children were dying because of all these viral diseases. Hepatitis immediately after birth is given, and after that, many other influenza, DPT, and all the different type of vaccinations now we have generated, and we are giving to the children in a sequence. and their booster doses starts up to 14th years of age. Means we follow the vaccination up to 14 years of age of a child. After 1 year, the second phase of the life starts, that is known as toddler's age. Most of the diseases still continue in the toddler's age, but there is a different kind of development in the children's life, bodily, habit wise, working wise, mentally. He develops lot in all the phases, and ultimately we have to follow those things. If your child is developing as per the normal routine of the children or not, and mostly up to 4 or 5 years until it goes to the school. But nowadays people are going, children are going to school even up to 3 years, and even before that into the kindergartens and all that. And but previously the children were going to the school up to 4 or 5 years, and that conditions we in the before that 4 or 5 years we take it, or you can say we cannot judge all these things competitively or comparatively. We judge all these things when our child goes to school, and then we find out that the other children are behaving this way, other children are working this way, other children are understanding this way. My child is not speaking with that fluency, my children is not understanding in that fluency frequently. So ultimately we compare it and find out that there are some deficiencies that we have to correct. So ultimately, in this toddler's age, we have to watch all these things, and we come to know about the deficiencies, and we should correct those one. And I have given you detailed lectures on this one. And after that, the child was entering into adolescence age. And in this adolescence age, I have told you there are a lot of changes which we were not expecting. If we are not understanding the differences between male and females, if we understand the differences, we see these differences visibly, physically, in a female or in a girls. These changes are visibly outwardly, just like I told you about the deposition of a face, deposition of fat in different organs, hips, abdomen, breast, and even face. Whereas in the case of male's structures, he is losing fat, but muscularly it is developing masculine body after that. And it all depends because of the different hormones they are creating. In case of female, the hormones estrogen, progesterone, follicular stimulating hormones, they are activated in larger amount. Whereas in the male partner, the testosterone hormone is activated and produced in large quantity. So that changes the structural and even the functional body inside that. So that I have given you the lectures about, and what is the function of follicular stimulating hormone, what's the function of estrogen hormone, when they start erupting inside the body, and from where, from the posterior pituitary or from the hypothalamus. So I give you the chain from where ultimately this starts erupting, and direction goes from hypothalamus to pituitary, pituitary to the ovary, ovary to its inner layer, and inner layer it produces follicular stimulator, and follicular stimulating produces LH hormone, and the oocytes produce the estrogen hormones. All these things I have given you in detail, that all these hormones are produced inside the body. And after that, in the male partner, I have told you about the production of the testosterone hormones. And in this way, the detail has been given one by one, step by step, that how this child, the life was developing. And now this is the time at the adolescence age that both the body are separately identified. No, though the bodies were identified when it borns, and the doctor says, oh, you gave birth to a male child, you gave birth to a female child. But ultimately I have given you the story of this thing, that this may happen in the early life in the mother's womb, when you do first ultrasound in the 20th week of pregnancy, and the doctor told you that you are having a baby boy. But ultimately, when it borns, then doctor give you the female child, and sometimes the controversy starts, questioning starts. No, in my previous ultrasound, you told me my child was boy, but now how it is the female child's. But now we know that how it happens because of the hormonal fight, because of the genetic fight inside. And that story I have given you about that the female genesis has 23 pairs of chromosomes. Out of one pair is X chromosome, whereas in the male child, the male sperm head, it has 23 pairs of chromosomes. Out of one, there is a X and Y chromosomes. So there are three chances of developing female body. There is only one chance of developing a male body. And ultimately, that fight. Suppose if it's a female child, very rarely some changes occurs in the later lives. But if it's a male child, this fight does not end even in the mother's womb and even after the birth of the child. So first of all, you see the child physically. Even ultrasound shows us. But after that, when it borns, doctor says something else which was different from the ultrasounds. And ultimately, now you believe it. It is born girl, it is born male, or whatever. You believe that. And ultimately, after believing this one, now the life is going on. And when it reaches to the adolescence age where we are at this time, adolescence age, hormones are erupting in a large quantity. And ultimately, what happens? A girl becomes boy, a boy becomes girls. You might have seen, witnesses these kind of incidences in all around your areas. But now the whole world has become a global village. That is why any incidents occurring in any portion of the globe, it reaches to you in a minute. So, in this way, we recognize, we know many of the instances which were happening where a male child has been converted into female child and a female child has been converted into male child at the adolescence age. And ultimately, this fight was not over. This fight was not over. And ultimately, it goes to the adulthood. When a child becomes adult, at that time, though physically girl is now girl, boy is now boy, even if it is converted from female to male or male to female, whatever has happened. But at the young age, you are trying to find out a girl for your son to get married, or you are trying to find a boy for your girl to get married. And at that time, when it is passing the adolescence age, at that time, a child says, no, I'm not interested in girls. And a girl says, I'm not interested in opposite sex. I am interested in girls. This thing can happen. This thing can happen. Because of that, fight is still going on. One type of genetic character occupies the mentality. The other type of genetic character fight the physical structure. So in this way, that fight still goes on now in different countries. It's a medical, it's a type of legal crime that a man is involved in a male, a female is involved in females. Thus, we have created the medical jurors has created the term lesbian. When a girl is attracted towards the girls and having a sexual relation with the girls, that is lesbians. And if a male child is attracted towards the male, that is homosexuals. All these things are going on, but now we are learned enough. It's not too far. When we was thinking this thing this is a crime, But now you know that, because it's all because of the hormonal problems, it's all because of the internal fight which is going on in the chromosomes still. And most of the countries, just like even in California, you might have heard that same sex marriage, this has been this has been advocated as same sex marriage, and it is legally accepted. It's legally accepted in most of the states of America, and even in most of the countries they are doing this one, because they are understanding this thing, that it is not a sin, it's not a crime. It's all because of the internal changes, internal uh, what hormone, sorry, what gene has occupied the mentality, what gene has occupied the structural formation of the body. If they are same, then male child will be attracted with the females, and female child will be attracted with the males. But if there is a different story, the different portion, the mentality and the physical, structurally, it is occupied by different other, then on that way, it comes into existence that you are trying to get your son married with a girl, or you are trying to manage for any boy for your girl, and they say, no, 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 we are not interested in those. We are not interested whatever physically we see, you see me. No, I am interested in some others. And they feel mentally that I am a different man, or I am a different female, which is fixed in a different body. Body is a man, mentally he is a female. So in this way, this is all because of those genetic characters, which is very difficult to cure. Forcibly, what you can do? Forcibly, ultimately, if you do that one, or if the child at this age is not outspoken, he will not speak that one, then what will happen? After marriage, there will be divorce, because he is not fulfilling the demand of the marriage. Demand of the marriage he is not fulfilling, even if it's a girl or a boy. Ultimately happens with that one. And I have given you detailed lectures in this is fair, that how it happens, what it happens, what were the condition inside going the body, and whether you can change it or not. Basically, most of the things which are genetically originated, we are unable to correct them. But if these conditions are not genetically originated, but because of the external environmental, because sometimes if you are living in an environment, and just like you might have heard about the jails or some other things, and there is a homosexuality and there's a lesbian characters, you will find irregular type of things, irregular type of things in the jails is going on, and in various other areas of educational or other type of institution. This is a routine, but they are not of that category that they do not like the opposite sex. No, they like it, but they are bounded by the circumstances. That is why they are attracted. But they are attracted with that one because that's a natural thing. Hormones are erupting inside the body. Though they may be suppressed because of depression, because of anxiety, because of some other problems, they may not having any sexual instinct in that. But it's a normal feature. We are talking about the normal features, and I have given you the bureau, if it's a normal or if it's abnormal, and we are talking about the normal things. This is a normal thing, but this is a something special thing, that a physical body of a man is occupying a mentality of the female, and physical structurally a female body is occupied by the male. So all these things, sometimes you might have heard about the old ladies grow beards and mustaches. That's a normal features. And that happens because at the declining phase, that's known as menopause. At the time of menopause, the feminine hormones, estrogen and progesterones, they are declining in their number. And when they are declining in number, the other hormone, which still exists in everybody, just like a male body, feminine hormones are still in small number of that one, because they ignite, they stimulate the production of the testosterone hormone. The same way in the females, there is a quantity, little small quantity of the testosterone hormone is produced, and that stimulates the production of estrogen and progesterone. This has been learned now. And in this way, that is why sometimes when a lady goes to the menopause conditions, it develops mostaches and beards on the hair, because the testosterone level in the blood rises at that time, because the estrogen progesterone level is declining in the blood. Their production is declining, and if it's declining, ultimately the other hormone will come up into practice. So in this way, their body, just like the soft body, is converted into musculines in case of the females, and in the male bodies there are also a different type of structure develops in the old age as well. So all these things, comparatively, with the comparative study I have given you, what happened in the females, what happened in the males, what are the changes you can recognize, that even from all these outside changes you can recognize that the lady is going into menopause. Or from the outside changes, a male body, you can recognize that he is passing through senile decay. So many of the signs we can see from the face, from we can see from the hands and the nails and everything, and color. All these things changes with the phase of the lives. So you can understand then those things, and all these things I have given you the details in these lectures, because many more months have passed. I am giving these lectures to you, and ultimately we are reaching to the stage of pre-puberty. Sorry, yeah, pre-puberty symptoms, or pre-adult age. Pre-adult age is the age which we consider that from 20th year of age to 35 years of age, when he is holding full responsibilities of his life, but he is not competent to perform all the duties. A phase, you can say, that is known as orientations. When you join a job anywhere, they give you an orientations of the work, what you have to do during your your working hours. So in that way, this period is known as, from sometimes some of the people consider it from 18 onward, but some of the people consider it from 20 onward up to 35 years of age. Till that, they experienced every problem of the adult life, married life, or even without married life. There are many more other types, because at that time the parent says, oh, you are not child anymore, you are responsible for your activities and all that things. And at this phase, at this age, it is very difficult for the children to adjust himself, because many more responsibility after marriage, just like you see that many more responsibility comes upon his head, and he is not competent to do that, he is not experienced about that one. And we are guiding to the parents that, oh, when a child is growing up, when your child has become adult, ultimately back up from your advices, just become the consultant. In spite of guiding each and every step, become the consultant. And when we go to the consultant, when we need it, if we do not need it, we do not go to the consultants. In this way, let him enjoy his independence, let him enjoy his adulthood, let him enjoy and do the mistakes and find out, and do the mistake and correct that. The mistakes are the best teacher for everyone, and if it corrects in a right way, it's a big lesson for us. Though some lectures are sometimes we learn many things with a very big loss, and ultimately it is difficult to compensate sometimes. But anyway, if as a parents you are there, yes, you hold some responsibility, but give him a free hand to work in his life, minor things, so that he can solve his own problems and he will learn from that one. And ultimately, with the growing life, he will learn many other things which you do not learn in your life, because our culture was a different type of culture where sometimes 2 or 3 generations were living together. But now, family, husband and wife or children. That's all. It's limited up to that one. And in this way, when you are having a wife and your children's, all the responsibilities falls upon you, and you hesitate to get advices from the parents sometimes. You do not talk about those one or your deficiencies, and ultimately you suffer from that one. Therefore, it is advised to the parents especially, watch your children even when they are at pre-adult age, because they are passing through many hurdles. They are passing through many responsibilities which they were not holding previously. Because previously you were holding his responsibility or her responsibilities, but now they are holding the responsibilities himself. That is why it may be sometimes difficult for him to manage everything. And at this time, I told you about the diseases. A person at the pre-adult age, what type of diseases he suffers and why he suffers from these type of diseases: anxiety, depression, asthma, obesity, STD, sexually transmitted disease. All these things I have given you the detail why these things happens. What are the causes behind that one? Why they are at this pre-adult age? So everything I have explained you in these lectures systematically. But I think today our time is going to be over. Yesterday I took a little more times, so sorry for that one. And now the time is over. Tomorrow, I think it's a according to Indian calendar, it's the day of Chote Sahibzade, and I think we will be delivering that lecture tomorrow in the evening time. And after that, we will start the head, neck, and body descriptions one by one, and also the diseases of those ones. Today's lecture is over, and I appreciate all of your concern that you are listening patiently and learning many things. If I request you, uh, if you think these lectures are of some benefit to you, you learn many things which you were not known to previously, then please add to these programs your nearest dearest, so that they can be family of our this Sehat Vigyan programs, and can learn many things in their lives and be benefited from these things. So today's time is over. I am your host Gurdeep Singh Sandhu, homeopathy consultant, and my clinic address is 9701 Sarah N Court, Dublin, California 94568, and my phone number is 408 687 1899, and my email address is homeomedicine at yahoo.com. HOMEOMEDICINE at yahoo.com. Anytime, if ever you want to discuss any problem at any age, or you are desperate from any treatment, please call me 408 687 1899. Rab Rakha, God bless you all. Will see you tomorrow. Thank you.